Hello, my name is Sadie Tolberg. I'm your FNP student today. Can you tell me your name and date of birth?
Yes, Bradley Tilburg, 8987.
All right. And do you have any allergies today?
No allergies at all.
Okay. And do you know what we're here doing today?
Yeah, if you're talking about what I'm feeling, I've been having a lot of pain in my right side,
Okay.
and it's just been getting worse, and it's just starting to kind of radiate like into like the rib cage area. It's been going on for about 3 days, just gradually getting worse.
Okay. So we're going to address that today while I do a head to toe assessment on you. So
Okay.
this is going to be a comprehensive exam that's going to check everything from your head to toe, and then I'll focus a little bit more on that pain that you're having and see what we can find, and we will go from there. So I will be touching you throughout this exam, but I'll try to let you know what I'm doing as we're going. So the first thing I'm going to do is I'm going to wash my hands. All right. And I'll be kind of moving from side to side as I have all of my equipment set up over here. All right, and so his general appearance is that he is clean and kept well appeared with hygiene, and that he establishes himself well and his posture is erect, and that he has a muscular frame. His skin is warm and dry, and looks to be clean and put together. I did see in his history that he does have some acne, but it looks to be well kept and taken care of and under control. I'm going to check your temperature and just going to see. I'm sorry that my hands are cold, that he is warm, not overly hot or cold like my hands. I'm not seeing any texture complications or anything. Do you have any open wounds or lesions on your skin? Okay. I'm going to assess your skin as we go throughout this entire assessment, but nothing to note at this time that I'm appearing. I'm going to move on to head and face. But this time, I'm going to put on some gloves just because I'm going to be touching him a little bit more. Okay, so I've already been looking at his hair, which is even and distributed while the color is normal. I'm not seeing any signs of male pattern baldness. And then I'm going to palpate your head. I'm not feeling any masses or any dentations, anything along those lines, which is normocephalic, no trauma noted. I'm going to feel his temporal region and then move down to his TMJ, mandibular joint. Can you clench your jaw real quick for me? Okay, perfect. Move your jaw from side to side. I don't feel any crepitus. Do you have any pain? Okay, perfect. Can you feel me when I touch you here?
Mm-hmm.
Okay, do you feel when I touch you here?
Yes.
You feel when I touch you here?
Mm-hmm.
Okay, so I've been checking, that was for checking the trigeminal nerve. Can you smile big for me? Smile. And make a frown face. Puff out your cheeks. And then raise your eyebrows really big. Okay, I was checking cranial nerve 7 for the facial nerve, and that is all intact. I'm not seeing any deviations. Now I'm going to check cranial nerve 1, which is olfactory. So I want you to close your eyes and I want you to tell me what you smell. Big, big smell. What are you noting?
That's coffee.
Perfect. Okay, one more. So keep your eyes closed. Tell me what you smell.
Like a lemonish.
Yes,
Yeah, cool.
perfect. All right, olfactory is intact. So that's trigeminal, or I'm sorry, that's trigeminal, facial, and olfactory, 3 cranial nerves, and that completes the head and face. And then we'll move on to the eyes. So I'm going to visually look and see the pupil, the conjunctiva, the sclera, and because I know you personally don't like anything touching the eyes, can you pull down your conjunctiva?
Yes.
So I can see? Okay, perfect, looks good. I'm going to check optic nerve number 2. So I'm going to grab my pen light, which I prefer, and I'm going to lower the lights in the room. And first, I'm just going to check your eyes for accommodation and check for Perla. And his pupils, I'm seeing are reactive to light, which is pupils equal round reactive to light, which is Perla. They went from about 4 millimeters to 2 millimeters. And now I'm going to check optic nerve number 2 with the ophthalmoscope. And I'm going to stand in front of him and I'm going to check his right eye by looking in his eye with my right eye. And I am looking for the red, and I am following in, and I am checking the red reflex. I'm looking at the fundus, and I am taking note
if there's any hemorrhage, if there's any AV nicking, looking at the retinal arteries, and I'm not seeing anything
out of the normal. Okay. Let me do the same on the other side. And I'm looking for that red reflex. The disc, optic disc, is less than 0.5. The cup to disc ratio and the retinal background is as it should be. Okay. All right. You see eye exams every year?
Yep, I get yearly eye exams.
Perfect. All right. Back, put the lights back on. Okay. And then I saw sharp margins and the cup to disc ratio, like I said, was 0.5. And the retinal vessels, there was no AV nicking and perla. And now I'm going to check the ocular, the cranial nerve 3, 4, and 6, which are the trochlear, abducens, and oculomotor. Not in that order. Oculomotor is 3, trochlear, and abducens by which we already did with Perla, but I'm going to have you follow my fingers. So follow my fingers with this cardinal, 6 cardinal gazes. Perfect. And then you're going to follow them in. Okay, perfect. And so he accommodated to follow my hands along, and your vision is intact. And you have what vision for the Snellen chart when you go to the eye doctor?
2015.
Perfect. Awesome. Wish we all had that. Okay, now I'm going to move on to the ears. I'm going to inspect the mastoid and the auricle on both ears and to look at the external auditory canal. And I don't see any concerns, any masses or anything, any leakage or anything like that. I'm going to test your hearing. I know that you've noted that you've had to see hearing in the past, maybe had some tinnitus, but you're left. Okay, so I'm just going to do a whisper test, and I just want you to tell me what word you hear in each ear.
Apple.
Okay.
Baseball.
Okay, and that's testing cranial nerve 8. I'm going to take a look inside your ear and visualize the tympanic membrane. Okay, and it is pearly gray and intact. Okay. Sorry about the cord. And this one is pearly gray and intact. Okay. And then I'm going to check the bone, air to bone and conduction with the Weber and Rhine test. And I do not have an actual tuning fork, but I have a fork. And so I'm going to strike the fork, and I'm going to place this midline on the top of your head. And I want you to tell me when you no longer hear or feel the vibration. Okay. Tell me stop.
Stop.
Okay. Perfect. That was exactly when it was supposed to be. And then I'm going to have this strike it again, and it's going to go on the bone behind your ear, and you're going to tell me when you no longer feel it, and then I'm going to pull it off, and you're going to tell me if you can hear it in the air. Okay. And you should hear it in the air. Okay. All right. So ding. I'm going to stop.
Stop.
Okay. Do you still hear it? Okay. And then we'll do it over here. Ding. I'm going to stop.
Stop.
Okay. Do you still hear it?
Yeah.
Okay. So we'll say that is perfectly within normal limits. And so you passed your Weber and your Rhine test. And so we conducted now cranial nerve number 8. And I'm going to move on to the mouth and the pharynx. And I'm going to note the buccal mucosa, the lips, the teeth, the palates, and the uvula. And we'll be testing the hypoglossal, the glossopharyngeal, and the vagus nerve. And I will be using a tongue depressor. I will be checking his gag reflex. Hypothetically, I will not actually do that to him. And I am grabbing my light here so I can see inside the mouth. And so I am having him say ah, and using the tongue depressor to pull down his tongue to see that midline uvula, asking him to say ah.
and also checking that gag reflex hypothetically to ensure that is intact. And I'm checking to look at his teeth to see if there's any dental caries, make sure it's in good hygiene. His mucosa is intact, having him move his tongue side to side, checking the cranial nerve 12, the hypoglossal, and everything looks to be intact. Uvula rises when he says ah, and that checks cranial nerve 9 and 10 with the vagus nerve. Also asked him to swallow as well. And so now we're moving on to the neck after we have completed the mouth and pharynx. We will be testing the cranial nerve 11, the spinal accessory, and I'm going to have that by asking him to shrug his shoulders when I put my hands on top. And he is strong against my asking him to move his face from side to side. And so cranial nerve 11 spinal accessory is intact. Now I'm going to start with the lymph nodes, asking him to tell me if there's anything that is tender. And so I'm starting with the pre-auricle and moving on to the post-auricle, down to the tonsillar, submandibular, under the chin, the submental at the front, and then down along the anterior and posterior cervical chains. And they're all non-palpable. And while I'm here, I'm also going to go along the subclavian, which is in the anterior portion, and as well as the axillary, without actually going into his armpits because he is ticklish in that area. But I would have him place his arm on my shoulder so I could actually feel up inside his armpit if that was the case. So now I'm having him sit on the side here so I can palpate his thyroid, and I'm having him swallow for me, but I'm feeling to see if there's any swollen features to his thyroid, as well as feeling for any palpable nodules. And then noticing that his trachea is midline. I'm also looking at the back of his neck to see if there's any deviations, any kyphosis, and feeling if there's any tenderness. And so I'm having him move back to his normal position and letting him know that everything looks okay. And I'll be moving on to the interior portion of the head to toe. And so I'm starting with the inspection, and then going to palpate or percuss and palpate and auscultate in various orders. I'm kind of just talking through it at this point, making sure that I'm hitting all of my main points so he knows what to expect. And so I am going to been inspecting. I'm not taking off his shirt. I'm asking him to say 99 to check tactile friendliness. I'm checking this in these 3 spots on the front, and felt the 99 as expected. And so there was no tactile friendliness noted. And then I'm going to note the point of maximum impulse at this position, as well as when he's leaning. But because he's muscular, we may not be able to see it through his musculature. But I am not noting any deviations in his skin or in his chest. I don't see any barrel chesting. I'm not seeing any work of breathing difficulty. Everything seems to be symmetrical, and I'm not hearing any audible sounds. And so palpating along the sides here, and I'm not feeling any crepitus or anything to note. So I will be moving on here shortly to percuss, and I'm going to start percussing and realize that I'm going to be moving on to a ladder-like position. So starting over, percussing back and forth in a ladder-like position, starting the top, moving down, and I'm listening for a resonance sound and not hoping to hear any dullness over anything unless there's an organ expected there. I'm also going to be auscultating in the same pattern and listening first for lung sounds. And I'm not hearing any crackles, rails, rhonchi, or any absentaceous lung sounds. He is clear bilaterally. In all lung fields. And then I'm going to go right into the heart sounds. And so we are starting with the aortic, which is in the right side, the second intercostal muscle. Then moving over to the pulmonic, which is on the left, second intercostal muscle. Moving down to the second pulmonic, or the Erb's point, which is in the third intercostal space. to the fourth, which is the tricuspid fourth intercostal space, and then down to the mitral, which is in the fifth intercostal space mid-clavicular line. This is also the apical. You would sit here and listen for 1 minute. This is also the point of maximum impulse. And so I am hearing even, no thrills, no murmurs, no gallops. I am feeling to see if I feel anything in that point of maximum impulse. And it is normal as expected. So now I'm going to ask him to move on the edge of the seat so I can do the same on the posterior side. And I will be inspecting the back first to note if there's anything abnormal with the shape or size. I'm going to test for a couple things for his lung expansion. And we'll also be doing the tactile fremulitis with the 99 4 times. And that is within normal limits. Then I'll ask him to take a deep breath in, noting the chest expansion. And then I'm also palpating over the CVAs, noting that there may be mild tenderness on the right side due to his abdominal pain that he's complaining of. But I'm looking for anything beyond what is expected. And I'm also I'm explaining to him how I measure his diaphragm by doing some percussion when he has his chest fully expanded, and then asking him to let all of his air out, and then percussing again and measuring the distance between the two. So I'm explaining to him how to go about this. He's taking his deep breath in and percussing to find that diaphragm. And it is within 3 to 5 centimeters, which is what is to be expected. So I'm not finding any concerns with the posterior at this point. I am inspecting. I'm doing my percussion in the same ladder-like position, back and forth. Also feeling that resonance bilaterally. No dullness or any other sounds. I'm going to auscultate in the same fashion. Not hearing any crackles, rales, ronchi, or any other adventitious sounds. Lung sounds are clear bilaterally in all lobes. I'm also noting the spine and his scapula to see if there's any noted deviation. He mentioned that he has some mild degenerative disc disease in his lower back. And so I asked him if he was feeling tender at any points, and he's said nothing feels tender. So as part of the musculoskeletal, I just kind of jumped ahead while I was back there for comfortability. So now we're going to have him lay back, kind of kicking this bed to lay back, his chair to lay back as flat as possible. And that's kind of as good as we were going to get. He did say it was comfortable for this video to pull up his shirt. And we're going to be as safe as we can with his abdominal pain for this video with any of the palpating that I will be doing. But I'm expecting the contour. It is flat with no visible pulsations or distension. He did say it was okay to pull up his shirt for this portion of the test. So I am looking to see if there's anything deviating just from visionary standpoint. And then I'm going to move on to the auscultating for bowel sounds in all 4 quadrants. He did tell me that he was having normal bowel movements and passing gas in the H&P. And so I am hearing active bowel sounds throughout. So they're normal, active. And so I'm not hearing any concerns at that time. I'm letting him know that I'm going to be doing percussion throughout his abdomen, and I'm going to be light, but I'm listening for tympany. When I'm over a organ, it should sound dull. And so right now I'm going to check along the liver border, and then I'm also going to be checking over the spine. And so I'm the spleen, I'm sorry. So I'm checking and palpating up along the liver border down from the bottom of his rib cage here, just to make sure that that is not enlarged, and that kind of ruling that out with the differential diagnosis as we go along. And so I'm letting him know that I'm going to start with the light palpation, and I'm going to be doing 2 specific areas that I'm going to be checking for one of my suspicions. And so as I'm palpating on the bottom right, the lower right, he's noting some tenderness. And then as I move up about 1/3, I'm palpating over the McBurney's point. It's 1/3 of the way between the umbilicus and the right anterior iliac spine. That is the McBurney's point. And as I place pressure on that, he is feeling pain. And that is tenderness, which is a positive sign, and that can indicate appendicitis or appendix inflammation. And so I'm noting that as I'm moving along. He's not feeling any tenderness, palpitation in the upper right or the upper left. And then once I move down to the lower left, as I push on and perform the Rovsing sign, he is positive for left side palpitation, which causes right side pain. So I'm gathering this information for a positive Rovsing sign and the positive McBurney sign for the suggestion of something going on with the appendix for my thought process later on. So now I'm putting it back on my stethoscope to listen for bruise. I'm going to be placing my stethoscope into the bell position here, and I will be auscultating over several different locations, starting with the carotid, going on each side, listening for any thrills or any bruise, checking the apical, the point of maximum impulse, and then I'm moving over the iliac, the iliac and the renal on both sides, and the femoral on both sides. And I'm not hearing any thrills or any abnormal sounds in any of these locations. Okay. And so I'm letting him know that we can chest now for, we're going to listen to his, or check his carotid pulses. And we'll do those one at a time. Go to his brachial pulses, and then go to the radial pulses, go to the femoral pulses, popliteal, uncross his legs, posterior tibial, and then on top of his feet I would take his shoes off, but the dorsalis pedis, and everything is +2 bilateral and equal for his pulses in the vascular section. And so I am going to test for JVD. I'm grabbing a straight edge, which is a tongue depressor, and then I have a little measuring tool just to make sure that it is within the proper size. So it's under 3 centimeters. So I'm finding the spot by having him turn his head to the side and measuring it, and it's under 3 centimeters. And then having him turn to the other side. It's actually not even visible on him in this situation. It's not even 1 centimeter. And so no JVD present. And then I'm going to take a look at his hands for clubbing. I'm not seeing any clubbing of his fingernails. And I'm going to check his cap refill, which is less than 2 seconds in all 10 fingers. So no concerns with vascularity with that. And so we're going to have him sit back up. And then I'm going to move on into the neurological section. And so I'm going to have him touch his finger and touch my finger. I had to correct him with the same hand. I think he was getting bored with me. Then he's touching my finger and following that. A couple of spots. Doing it with the other hand. And then I'm instructing him to take his... we're doing the heel to... we're doing the Romberg test first. So he is standing with his feet together, eyes closed, making sure he's maintaining his balance. And then I'm having him walk heel to toe across the room, maintaining a straight line. And he is doing great. And that's it for standing. While he's standing, I'm just noting his gait and looking at everything else. I'm going to ask him to take his heel and run it down his shin on both legs, guide it along down, making sure that he can follow that task. And then I'm going to test his reflexes. And so I have a reflex hammer. I'm going to start with the brachial reflex in the biceps. I'm going to start with the biceps deep tendon reflex, and then I'm going to go to the brachioradialis, and I'm more noting what I'm feeling. Some of these I can see him visibly move. Some of them I'm feeling it with my hands, with more of his response. And so I have to kind of get it at the right spot here. And so I could see some of them I was getting him really good, and some of them he was not responding as well. And then going down to his Achilles. After that was his patellar, his knee, and then doing his Achilles, which is right behind his ankle on the backside, and then testing his tricep. That one I had to kind of feel a little bit more, but our PA who was in the military explained to us a little bit about how that one can be kind of difficult with the military because of their something with their rucking. He showed us a few ways to test that, but everything is +2 and symmetric, equal bilaterally, as to be expected, and walking through all of the neurological is intact, and then getting ready to move on to musculoskeletal. And so I'm asking him to squeeze my hands, strength, and not push me over because he's much stronger than me, having him push against me, pull away from me. And then I'm pulling against him, pushing against him, and then having him push up, just kind of testing muscles in different areas and different strengths. He's giving me a workout. And then pushing his legs out against me, having his feet push up and then against me, and then push down like he's on the gas pedal. And then I'm going to ask him to do some range of motion, asking him if he's having any issues with his range of motion. And he said no. And then working on if he has any issues with his joint mobility. He says he doesn't have any issues. Bend forward. And I already noticed this when he walked earlier as well. So no issues in any of his range of motion or strength. So musculoskeletal is intact, 5 out of 5 throughout. And then as I'm kind of walking through my mental checklist of everything, I realize that I have to do the sensory test. And so I have a Q-tip. And so I am going to ask him in several spots on his body if he feels anything soft or sharp. He said soft. He said sharp. He said soft. He said sharp. I did not warn him. And he said soft on that one. So he technically kind of failed that, but I let him pass because he passed everything else. And so this includes the head to toe assessment. Thank you so much.